Hi, I want to talk to you today about Ultherapy, or Ulthera as it's also known. Ulthera is the only device in the United States that is FDA approved for a non-surgical brow lift or neck lift. It does not have the same outcome of surgery, but our patients love this technology because it gives them an impressive outcome without any downtime. How does it work? It uses a technology called focused ultrasound. Our technicians or nurses, in fact, or PAs, can actually see on a screen the depth of your skin. So we have skin, subcutaneous tissue, which is fatty, and then underneath it we have the muscle. On top of that muscle is a fibrous covering called the SMAS. If you were to get a facelift, it's the SMAS that's pulled up to cause that lift. Lifting the skin alone does not cause or create long-term results. So this technology goes in, we're able to visualize we're on the SMAS, and we heat it up in little columns using this technology. Over time, that heat stimulates collagen in a way that tightens or lifts that SMAS up. And in the clinical trials, they were actually able to demonstrate high enough changes in lift that they got that FDA approval. There's several places we can use this. On label or FDA approved is the brow, around the eyes, which can give you a more of an open look, the neck, which does better if we treat the lower face at the same time. So that gives you that lift all through there. It's being used across the country and even the world in other places too. People are using it anywhere they want more lift, above the knees where the legs get crepey, on people's bottoms to lift that up, sometimes on arms. So there's lots of things we can do with this technology. As far as the procedure goes, when it first came out, I thought it was pretty uncomfortable. It can get very hot. It's most uncomfortable in people who've had surgery or trauma to the sites we're treating. But we've learned recently some great ways of helping mitigate that discomfort. And what we're doing is we're injecting lidocaine or numbing solution into nerve blocks, particularly on the face. Sometimes we actually thread the lidocaine, and we're getting so much more comfort level with our patients. The downside to those is anytime you use an injection, people can bruise, and bruises take 7 to 10 days to go away. Some people do fine with just a topical anesthetic, and we're certainly willing to do that as well. So we kind of work with how each patient's doing. We use other things during the procedure to make it comfortable. But without a doubt, the vast majority of people love this technology. You can feel that tightness for a couple weeks typically after the treatment, and then maybe the frustrating part is it's a little bit like watching a flower grow. You don't get to your full outcome for a year. The first time I did it, I did half a neck. I had the nurses treat half my neck. And for a couple months, I didn't see any improvement. By about the 4th month, it just started going up and in more and more. And I let it go for a full year before I let them treat the other side. I needed to see for myself that this technology worked. It's got a very high satisfaction rate in most of the studies that are done, and our patients come back for it over time. In my case, my repeat treatment wasn't for 3 years. It doesn't go away like Botox or fillers. What it does is you keep aging. And so you'll love this technology, and you will want to repeat it with time probably, especially if you're trying to avoid surgery or the downtime associated with it. One of our favorite treatments is Ultherapy. Call our office to schedule a consultation. We can show you photos. There's photos on this website. Thanks so much.